Yin have 2 sets and Yang have 2 sets. Yin are either in wood order or metal order. Yang are in metal order or wood order. And we said that yin points and yang points have the same benefit. So it does not matter which you choose. It will be giving the same benefit for any condition. So there is no indication that you should choose either yin points or yang points. That's why you arbitrarily choose either yin or yang points. You cannot do both at the same time from the start. But you can do both yin and yang points if you know which set to use. And in order for you to know which set to use, you have to use one set at a time. For example, yin points, is it 70% set or is it 30% set? You gotta first verify that that works. After you find out whether 70% or 30% works, then you choose the yang points and determine whether it's a 70% points or 30% points are effective. After that, then you could do both side acupuncture using yin and yang points together. But we're talking about initial step here. Step number 1, without having done anything, without having treated this patient, what are you going to do? Okay, just pick yin or yang points. And then number 2 is choose either right side or left side of the body. Because right side or left side of the body acupuncture gives the same benefit regardless the problem is on the right side or on the left side. And then step 3, of course, you got to give the 70% likelihood set. For yin points, then 70% likelihood set of points is wood order. And the 30% likelihood for yin points is the metal order points. For the yang points, the metal order points are the 70% likely that it will work for that individual. And then for the wood order using yang points, then you have 30% of the people who will respond well with wood points. With the 70%, if you don't have a relief, then you give a 30% set. Of course, 70%, give 1 treatment, no relief, 2 treatments, no relief, 3 treatments, no relief, 4 treatments, no relief, then of course you cannot repeat the same. You need to give the 30% points to give the benefit. All right, needle retention is between 20 to 30 minutes. Okay. Now we will go into subjective and objective. Here, subjective and objective way to measure. In science or in physical medicine, or what we have learned, or what the public has consensus on, is to be as objective as possible. It's because nobody wants to tell somebody something that's wrong, or something that one thinks subjectively and tell the other person that is true. We gotta verify that it's true. In order to be verifying that it's true, it has to be objective. Objective is something that's very tangible and it's independent of what I think, what I feel, what I know. Okay? It's independent of all that. It's just the way things work. For example, gravity is objective. Okay? And like a physical science is objective. Chemistry is objective. You build a very nice car. Hello. Good to see you. Yes. Okay, so we just went over the Bisoma method. Step 1, 2, 3, 4, 5. Very simple. Choose yin and yang points, yin or yang points, right side or left side. Give 30%. Give 70%. And if 70% doesn't help, give 30%. And the treatment retention is 20-30 minutes. Okay, so we talked about that. Now we're getting into how do you measure the outcome? Objective measurement or subjective measurement? Okay, objective is very physical. Like, for example, gravity is very physical, and it doesn't matter what you think. Gravity exists. Moon. It doesn't matter what you think. Moon exists. Or the earth revolves around the sun. It doesn't matter what I think or anybody thinks. Earth revolves around the sun. And we have many modern technologies today based on the objective findings. For example, a car gets better and better every year because we know the science to this. And we go down to even nanotechnology because we're able to measure very, very specific in the very minuscule length. All right, that's objective, and in medicine, we're trying to be objective too. That's why we have scanning, CAT scan, MRI, X-ray, and we have artificial intelligence now being able to read these because artificial intelligence is also objective. And what about blood test? Yeah, chemistry is objective. And urine analysis, stool sample, also objective too, because it counts how much bacteria there is. Okay. And the better we're able to measure things with devices, easier for our lives. But not everything is measurable. A good example is, two good example. Somebody's going through stress, anxiety, PTSD. Is there a device that measures it? Or we're just going to have to believe what the patient says? What about pain? Is there a device that measures pain? You go to the doctor and go, I got pain. That's the most frequent condition we see doctor for. How come there's no device that measures pain? They ask you, rate it 1 to 10. 10, you can't move. You're crying. Number 1, a very little bit, but you're doing things throughout the day. That's taking the word for it. The patient says it and the doctor believes it. What kind of medicine is that? Well, if there's no device that measures it, then either the patient, we have to be skeptical of the patient. The patient is lying, in other words. Okay? Or we accept that the patient is not lying. But it's subjective. Okay. Then also, you know that concept. Every human being is a universe. Each person is wide and deep. There are so much so that even that individual is on a continual discovery path, on that journey of discovery of oneself. That's saying, know thyself. Okay. what I'm saying is that other people cannot know the other person. Even the person cannot know the self. But the person knows the self more than the other people do. Therefore, what the patient says is taken as is because they know their history, they know the cycle of the same things that are happening over and over and over again. And based on that history and what they need to improve upon, they are able to measure. So there are two main ways to measure subjectivity. One is health, and the other is well-being. Health is less problem, better function. Like for example, I'm sleeping longer, I'm sleeping deeper. Okay, you can measure that. Or how one has the indigestion as an example. Okay, bloating or stomach ache or too many bowel movements, loose stools or frequent urination. Those are all related to health. The patient knows and needs that improved upon. So when that health status improved, then there is a noticeable improvement. That's why you ask the patient in 3 ways here. Can you tell that you're getting better? How can you tell that you're getting better? Tell me either of the 3 answers. 1, it's, I don't know. I cannot tell. Oftentimes, patients cannot tell if they're improving or not. 2, it's the same. It's less than I don't know. It's just same. Before it's same. The frequency is the same. Intensity is the same. The duration is the same. Everything is same. I don't see any difference. Okay. Third answer is, yeah, it's better. Better means it's more than I don't know. Is it mildly better? Moderately better? Very much better? Well, in the better category. Rate of improvement is important, but not as important as direction of improvement. You want the patient to improve fast, but you gotta first get the patient improving. Okay, so there's one way to measure, which is health. Another way to measure is well-being. Well-being is the quality of oneself on a day-to-day basis. For example, mind is more focused. Mind feels uplifted. Body feels uplifted. There's stamina. I have hope. I feel positive. I have clarity in my mind. I think and my body does. My transition from sleep to wake is quick. My transition from wake to sleep is quick. My sleep is good. My appetite is good. I play. I enjoy when I play. I work. I have a project. And I'm working on the project. I'm focused on it. I'm not missing work. Or I'm not compromising my project, in my work. I'm not compromised when I play. I'm not compromised with my appetite. I'm not compromised with my sleep. Those are all well-being. How do you know if that's getting better? You ask the patient. Then the patient is the gauge. Patient tells you what the difference is. That's good enough. How am I gonna figure that out? The patient knows the self more than I do. Okay, very good. That's the difference between subjective and objective. We don't have to know the objective. We don't have to get all this tests to know. However, having both objective and subjective would be better than just subjective, than just objective. It's just that oftentimes we don't have objective information, so we're going to use subjective information. All right, next thing here, we're going to go to the case studies. So real person examples. I think so far up until this point, we were doing theoretical, hypothetical ideas. So let's read this here. The first case here, case 250. Male, age 77, college professor. 2 years ago, the patient fell backwards onto the floor while pulling out a cart with his feet on the wheels at a market. And when he fell on his back onto the floor, he heard a pop in his spine. Upon examination, they discovered stenosis. So that's objective. How do you find there's a stenosis? That's MRI or X-ray. Other than that, you wouldn't know there will be a stenosis. Stenosis is in the spinal column, in the spine, there's a hole. And that's where the spinal cord is. And in that hole, the bone grows into the hole. Bone from the vertebrae grows into the hole and squeezes on the spinal cord. What are you going to do about it? That's very objective. It's like you can't change that. You can never ever change it. Even there is no surgery for it. The symptoms are the patient had pain in his buttock and sciatica down his leg, and any position he slept, on his left, on his right, on his stomach, on his back, any position, no relief. He had to get up every 2 hours. And the sensation was sharp, like a needle just keep pushing it in. The pain was so severe that he couldn't do physical therapy. Because he moved a little bit, it hurts a lot. Tramadol is a type of medication, and that only caused constipation and did not reduce any pain. He was suffering from this for 2 years, every night. I gave him acupuncture on the right side. It says he has pain on the right side, correct? What if I give him acupuncture on the left side? Result is just as good, but why did I do it on the right side? Because patient might find it weird, strange. But also for 3 years or 4 years, I did acupuncture on the opposite side. I had good relief. And so I make it simple now. I just give acupuncture on the same side of the pain because it works good enough, and I don't have to explain to the patient why I have to do the acupuncture on the opposite side. So I chose the right side arbitrarily. And I chose the yang points arbitrarily. I could have done yin points, could have given the same benefit, but I chose the right side. In the metal order, because that's the 70%. 70% means 70% of the population have metal order correct for them. That's Li1, which is metal point on metal meridian. UB66 is water point on a water meridian. Gallbladder 41 is wood point on a wood meridian. Small intestine 5 is fire point on a fire meridian. Stomach 36 is earth point on an earth meridian. So I gave that acupuncture. What happened? Well, before I tell you what happened, you can see the images here, right? 2 needles in Li1, 3 in small intestine 5. So the treatment is between 20 to 30 minutes. I put one needle in Li1, 2 needles in small intestine 5. 10 minutes later, I put in 1 extra needle in Li1 and 1 extra needle in small intestine 5. Okay. Here, UB66, you see there's 2, gallbladder 41, 2, stomach 36, it looks like there's 2, but there are 3. UB66, I put in 1 needle, gallbladder 41, 1 needle, stomach 36, 2 needles. And then 10 minutes later, I added 1 more in each spot. That's why you see multiple needles in one acupuncture point. Okay. The patient received acupuncture twice a week. After the first treatment, the patient experienced relief that exceeded expectation. That means it's not, I don't know, it's not same, it's definitely better. It's not mildly better, definitely better. The range of motion improved in all planes, right, left, up, down, front, and back. And the following morning showed continued improvement. That means he got immediately better after the treatment. And he slept that night better. He woke up next in the morning and he was still better. I think you know the movie called, what is that movie? I forget the name of it. He wakes up every morning, same thing, same scenario. Groundhog's Day, right? So he was having Groundhog's Day movie scenario for 2 years, and that broke. After the second treatment, the patient condition significantly improved. That means it's clear that the improvement was significant. While waking up in the morning caused some aches, getting up relieved the pain. So then, in the middle of the night, he was able to sleep. He woke up in the morning with a little bit of pain. But when he moved, it went away. The patient experienced a linear improvement without any fluctuations in pain, intensity, frequency, or duration. The patient experienced linear improvement. Linear means straight up, not up and down, up and down, up and down, up and down, but still going up. This guy was just straight up improving, okay? Majority of people up and down, up and down, up and down, up and down, and they improve. But him, he responded very well, very quickly, very significantly, staying better. 3 ways to measure: less intense, less frequent, and shorter in duration. When patients meet those 3 things, that means they're getting better. It's not that there's a maintenance or there's a control. It means there's actual recovery that's happening. And even in severe situation like this, a stenosis, sharp pain every night for 2 years, how can it improve like this? Is it because it's a light condition? Perhaps not. This is a severe condition. He improved because he has reactivity to acupuncture. Some people with light condition have very low reactivity to acupuncture. That means they don't improve as well, although they may have a mild condition. Hello, who is this? Hi.
This is Paula, the one who's helping us get our organization going.
Hi, Paula. Nice to meet you. Okay.
She's driving for me so I can take the class.
Well, you gotta listen too.
Yeah, she'll listen.
Yeah. Okay. Very good. Very good. All right. So overall, the patient. Oh, 안녕하세요. Yes. Yeah. I'm glad you joined in. Perfect timing because we're talking about a low back pain patient,
Okay.
and gave him right side yang point 70%, and he improved very, very quickly. And so then overall, the patient's condition improved by 70 or 80% only with 2 acupuncture treatments. This patient has stenosis. You know what stenosis is, right? Yep. Stenosis and sharp needle pain in his hip for 2 years. He couldn't sleep. Like every night, he was waking up every 2 hours. With only 2 treatments, he improved 70-80%. That's 3/4 of improvement. Well, how could that be? It's because it's not the severity of the condition, it's because some patients react very well to acupuncture. I think about 1 out of 20 people are like this. Okay? It's not high, but it's not low. Okay? Especially people who cannot go anywhere else, you help them, then this is like miracle. Okay? Because we're talking about people who are not helped. Because this guy took medication, and the medication did not even reduce his pain. He was taking opiate, tramadol. Okay? And he wouldn't reduce his pain at all. Then how come acupuncture did? It's because he's very responsive to acupuncture. About 1 out of 20 people are like that. After the 3rd treatment, the patient experienced one evening of bad pain in the middle of the night in the lumbar region, but there was no sciatica. Yes, this patient was improving very linearly, and of course there's some times when it's not, but it's short-lived. Following the 4th treatment, the patient's condition dramatically improved further, or dramatically improved, right, already dramatically improved. After the 1st treatment, the patient reported overall relief of 90%. After the 6th treatment, the patient experienced normal stiffness in the mornings, but it went away after walking around and stretching. The patient reported being 99% asymptomatic with no more sciatica or neuropathy. Okay. Discussion. The intractable pain was ongoing for 2 years and there was a structural problem in the spine. However, he was highly reactive to acupuncture, resulting in such a dramatic relief. Yeah, so this person had a very good relief. You cannot expect that to everybody, with everybody, but it's not uncommon. Okay, it's common with the acupuncture. And he first came to me 2 years ago. 1 year later, pain started coming back. I gave him acupuncture. Same good response. And then he came back this year. He had 6 acupuncture treatments. And the pain went away again. After acupuncture is good for a long time. It's nice to get rid of pain forever, but we know that's not realistic. That means we have to be available. Question is, how often do they need acupuncture, not whether they do or not. Okay? And so even if I'm not available, we have the patient file. Somebody else could repeat it. Yeah. And we also talked about acupuncture promoting healing. That's why he gets better and stays better. Because acupuncture promotes healing is anti-aging. That's why after age 35, regular acupuncture is relevant. This makes it very different from biomolecular medicine. Biomolecular medicine does not promote healing. It's what you call intervention medicine. They even say that it's intervention medicine. because without the medicine, they either remain the same or they get worse. I know this is a criticism, but biomolecular medicine is great for two reasons. One, emergency, life and death. You gotta save life. And the other reason is, if natural medicine cannot do it, then they have to do it. Therefore, it is our responsibility to make natural medicine better. And I think Dr. Leoncio is doing that. You've been doing that for a long time. Thank you. Okay. All right. Next case. Pain and heroin habit. Male, age 23, technician. A severe car accident 6 years ago caused multiple broken bones, necessitating extensive corrective surgery. He had constant and chronic low back, bilateral sciatica, right arm, and left leg pains. He was still in a constant pain at a minimum level of 6 out of 10, so never under 6. It was easily aggravated with small amount of physical exertion. That means he moved a little bit, more pain. He had a lack of motivation, was often bedridden, and the mind couldn't function freely. The amount of sleep was between 2 to 3 hours a night. His accident was when he was age 17. Bad accident. And it was so bad that he even had, like, I think skin graft or some kind of graft in his arm. So he had multiple surgeries. Okay. And he was addicted to heroin. He was in such a severe pain for a long time. He's been on opiate for so long, right? Eventually, they cannot give him opiate anymore. And then what does he do? He goes look for heroin because he's addicted. If the doctor's not gonna give it to him, he's gonna find it. His mom brought him to me when his mom brought him to me, and he was in a drug rehab house. He was in and out of drug rehab. So his mind was addicted, his body in pain, body addicted. Acupuncture. I gave him acupuncture on the right side. Okay, right side, left side, result is the same. Yang points, yin points, result is the same. And of course I did the 70%. LI1, UB66, gallbladder 41, small intestine 5, and stomach 36. And additional wood points, LI3, small intestine 3, stomach 43, and UB65. You know, those are all third point, right? Jingwell, spring, and then stream points. Well, spring, stream. The third points, LI1, small intestine 3, stomach 43, UB65. They're all wood points. You agree? Okay, they're all wood points. Because his diagnosis was lesser yang and greater yang, or his diagnosis is soyangin. You probably heard that word, soyangin. Okay, because he's soyangin, I gave him wood points. And because he's pitta vata in Ayurveda, I gave him wood points. You see how the names are different, but same diagnosis? Okay, because each region in the world have their own words, but same diagnosis. Okay, you and I are unified. All right. Okay, we just discovered these points for our regional medicine. Okay, now for him, I did not give wood points at the beginning because I didn't know his constitution. Okay, I saw him several times, and then I gave him his diagnosis acupuncture. But on the first day, I only did 70% yang horary points. Okay, let's keep on reading. The patient had 18 acupuncture treatments in 3 months so far. During his first visit, he slept through the whole 25-minute session and 30 minutes more until he was prompted to wake up. Okay. He came in with his mom. He says he had the best deep sleep in years. He came with his mom. His mom was sitting in the room. I gave him acupuncture. I walked out, came back in. 15 minutes later, I gave him additional acupuncture. And then total 30 minutes later, I came in. It's like he's still sleeping. He's sleeping like a baby. So deep. His mom was like staring at him. Because like she couldn't believe it. It's like she's staring at him. And then I kept coming in every 10 minutes and it's like, whoa, okay. So he slept for a whole hour. And then I think I was busy. I needed the room, and so I woke him up. But man, even his face looked good. Like that deep sleep coming out of it, that kind of like a drowsy face. It looked good. And then he also had a linear improvement. Every week was better than the previous week. Each treatment was better than the previous treatment. How do you know? He told me, right? Subjective. Less intense, less frequent, and shorter in duration of the problems, not just one. Because he had insomnia, he had drug withdrawal, he had pains all over his body, back pain, arm pain, pain everywhere. After the 13th visit, he was able to exercise for more than 1 hour without aggravation. By the 18th visit, he reported having close to zero pain. And this was 5 years ago. He's still doing better. From the 13th visit, he's 23 years old. Okay? So, what's a good way to verify that he's actually doing better? By exercising and bulking up. I'm a guy. I'm going to build up my muscle. He was doing that. And he was gaining muscle weight. So the weight training did not aggravate his problem. He was just getting better and better and better. Mind getting better, body getting better. And he could see the reality in his physical body. He's changing. He's getting buff. He's getting stronger. And that showed to him that now he could live his life. He proved to himself that he could do it. All right, so then, okay, how effective is acupuncture for drug withdrawal? Very effective. Not for alcohol, not for nicotine, but for opiates, cocaine, methamphetamine, fentanyl. Fentanyl is an opiate. Okay. So then acupuncture helps the brain chemistry come back very quickly. And he is an extreme example. Okay, 1 out of 20 example. But I'm confident for those who have drug withdrawal, out of 20 people, definitely 15 people will see significant and good relief in withdrawal. Like for example, just giving 6 acupuncture treatments would be enough to go, oh, okay, I know I'm getting better more quickly. Okay. All right, discussion. Chronic pains make it difficult to have a healthy mindset and live a normal life, of course. Because if the pain has been for a long time, then the person cannot be thinking normally anymore. And it is easier to take prescription medication and illegal drugs to relieve the anguish. Because that's quick. What other choice is there? There's no better choice. If there's something that's better to replace, then of course you'll do that. Acupuncture seems to be the only one that can replace with a better choice in a significant way. Okay, next. Spider, hold on. Okay, if you have any questions, just bring it up at any time. Okay, while I'm talking, just bring it up.
Okay, I didn't want to interrupt you, but I was just curious. So the acupuncture formula that you used for him was that yang order, the first one.
Yes.
And then you added some other transporting points on there. So it's we can use multiple transporting points. We don't have to just use the one formula.
Well, to start, you have to use one formula.
Yeah.
Yeah, because you got to go step at a time.
Okay, so eventually, though, you started adding, like, you add stomach 43, and you add bladder 65.
Yes, yes. Okay, there are three stages to this. 3 stages. First stage is, I said, 2 weeks, right? So for you who already have been doing acupuncture, like 2 weeks is enough. I'm not saying like 1 day, 1 week. I'm saying like a full week for 2 weeks. Then it's enough to know Bisoma. But 3 days is even possible. Because you see how I'm describing a lot about Bisoma here? But let's say there's a gathering of 50 people and all 50 people get acupuncture. Or let's just say there's an event and then 50 people get acupuncture and they all have pain or some kind of problem. Okay? Hot flashes or pain or menstrual, whatever that is. And you give acupuncture, you give a feedback in real time, in 30 minutes. And then you give that person acupuncture again, and you get a feedback of additional improvement, and that person comes back tomorrow, get additional acupuncture, and even better, and every day there's a continued progress. By the 3rd day, you're confirming by all this good feedback of treating many different things. Then you'll say, I have mastered this. Would you agree with that thought? Okay. All right, so then the first stage with this is Bisoma acupuncture, between 3 days to 2 weeks, of which will be enough to master. Okay. Second stage is knowing the constitutional medicine, 사상 constitutional medicine. Why? Because 사상 constitutional medicine is East Asian medicine. It's part of Chinese medicine. But it's not Chinese medicine because Chinese people don't do it. Okay? Only Korean people do it.
All right, my connection died. Sorry.
Yes. Okay. Only Korean people do constitutional medicine. But same points, same herbs, same food. Okay? In order for you to be mastering constitutional medicine, it'll probably take a year or 2. Why? Because it will need to do a lot of seminar. And you'll need to do a lot of diagnosing. And you'll need to do a lot of herbal application feedback. You give Chinese herbs, they get better, okay? Then you do that full time, then it'll take you probably 2 years to master 사상 constitutional medicine. And then the third stage is maybe you want to get into world medicine, Unani, Ayurveda, okay? Or maybe share it or connect with practitioners of India, practitioners of Africa, Middle East. Okay? That's the third stage. So then the first stage is what we're doing now. Second stage is giving you a taste of what it's like. Or right now, I'm giving you a taste of what second stage is like. Does that help?
Yes, for sure.
Okay. All right. Okay. All right. Any if it's not clear or if you want to repeat, just go ahead. All right. I like just you just jumping in and talking. I'm totally fine with that.
So it's okay though. And we're doing multiple points, not just the Bisoma points.
Once you know the constitutional points, or once you have the diagnosis, then you throw in the constitutional points. I said wood points for 70%, right? The third point?
Yeah.
If he was 30%, not 70%, then where would the wood points be? If he's 30% young, not 70% young. If he's 30% young, the wood point would be the first point, the well point, not stream point. Well point as in stomach 45, UB 67, LI 1, small intestine 1. Okay, that's why you want to know 70 or 30% first before adding constitutional acupuncture. Make sense?
Okay.
Yeah, makes sense. Yeah, so that's why we're doing this step by step. We have to do it step by step, and I'm doing this step by step too, even today. Okay, all right. Next case, spider poison, headache, neck pain. Okay, Bisoma, Tetrasoma acupuncture. So Tetrasoma is the tetra means four. Okay, Sasang means four. Sasang medicine. For constitutional medicine. That's Ha is for. Sang means constitutional. So Sasang medicine. Okay, for constitutional medicine. Tetrasoma is English. It's Greek word. Tetra means four in Greek. Soma means body in Greek. For body. Okay, Bisoma is two body. Okay, this is a female, age 36. The patient initially came in for a chronic headache and neck pain for 19 years. Alright, so she had that since age 17. 7 acupuncture treatments had much resolved the pain. Then she had a poisonous spider bite in the middle of the night in bed. It was a black widow stinging her left trapezius, causing severe chills, pain, swelling, and profuse sweating all through her body. Morphine and NSAID. NSAID is non-steroidal anti-inflammatory drug. They did not help at all. And she worked for Veterans Administration. She was a nurse at Veterans Administration. So she has doctors that she could see. And not much to do about it other than just to wait. There was no medication for it. I gave her left side yang horary points in wood order. Gallbladder 44, small intestine 2, stomach 43, LI 5, UB 40 or stomach 36. Okay, so that's wood order. Left side I chose because it was either left or right. Didn't matter which side. I chose left side arbitrarily. I chose yang arbitrarily. Yin would have been same benefit. Of course, I did the 70% first. That did not give her relief. Remember, she came in initially for her headache and neck pain, and it got better. 70% did not help. And so I gave her 30%, and it helped. And she was a soyangin, a pitta vata. And I added the wood points, which are stomach 45 and LI1. You see how 30% makes the wood point different? And so that helped to also reduce her headache and neck pain. That was the treatment process. 7 acupuncture sessions at twice a week visit resolved 80% of the headache and neck pain. So on the first visit, I did not do 30%. I did 70%. That didn't work. That's why I changed to 30%, the wood order. And then she had either during the treatment or when she was done with the treatment, whichever it was, she had a spider bite. And I gave her the same acupuncture points. They were for headache and neck pain. And it also helped her to detox. Okay? Using the same points. That's why we call this constitutional acupuncture. Constitution is something you're born with, you're never ever changing. It's the same in your whole lifetime. It's the way it is. And that's what makes it so simple. Once you discover the points, then for any other problem, you use the same points. So this acupuncture is not problem focused. It's for the person. Okay? Think of any medicine, any biomolecular medicine that is not problem focused. Any biomolecular medicine that treats the person. Is there such a thing? You see how natural medicine is therefore different? All right, next case is chickenpox, and that's often a childhood condition. Only age 4, the patient had chickenpox for several days with inflamed red eruptions and itching. Acupuncture left side yang horary points in metal order of 70%. Retained for 15 minutes. Oh, LI1 and UB66 were not needled because they were painful for children. He's only 4 years old. 2 things about children. One is that their skin is very sensitive. So it's not easy to do all spots. You could take out LI1 and UB66 and it's still forgiving. The reason is because children are highly reactive. Children in general are more reactive than adults are. Therefore, children respond to acupuncture way better. Let me see. In addition, being a greater yin, subconstitution, and tetrasoma, either fire point, small intestine 5. Oh, okay. This is an additional information. I diagnosed him as a greater yin, lesser yin. So if he was a greater yin, lesser yang, then small intestine 5 would be the fire point as a central point. Or if it's a greater yin, lesser yin, then stomach 36 would be a central point. So that's an added information about tetrasoma acupuncture. In tetrasoma acupuncture, you needle the central element points, or you do 4-needle technique. 4-needle technique requires more explanation, so I did not put that in here. Treatment process, yes.
So the terminology, you're saying like a combination of like a Tai Yin and Xiao Yin? That there's a combination?
Yes, Tai Yin and Xiao Yin combination.
Oh, I
is
didn't know that the constitutions went in the combinations. I've only learned 4 individual constitutions, Sasan.
okay. Let me explain that a little bit. 소양인 is a Xiaoyang and Taiyang combination. Let me backtrack even further, okay? Since you talked about Tai-Yin here, all right? Let's really backtrack. There are 5 elements. There's a common talk about which element are you? You've heard that before? Am I wood? Am I fire?
Yeah.
Am I earth? Am I metal? Am I water? As if there's one. Okay? Out of 5 elements, which element am I? It's like saying, well, in yin and yang, which yin am I? Am I yang or am I yin? It doesn't make sense because you're both. In 5 elements, you're all 5. You're not one. You're going to go, well, which element is the most diseased? Which element has the most problem? The answer is all of them are off. Okay? There's central element for the constitution, but that's the person, not the condition. But all 5 elements are off. So you don't say one element. You don't even say 2 elements. Tai-Yin constitution is big liver, small lung. You've heard that before, right?
Yes.
Yeah. Liver is wood, lung is metal. Big wood, small metal. Just 2 elements? What about fire? What about earth? What about water? So Tai-Yin constitution has big wood, small metal, big fire, big earth, and small water. All of them have to be adjusted. I think we talked about also last time puzzle. And there are puzzle pieces. Sasan constitution that we know right now are pieces. The more pieces we discover, we get to see the whole picture, the whole puzzle. What we learned Tai-Yin is just one part of the picture, because that's talking about 2 elements. That's very important in herbal medicine. But in acupuncture or diet, you have to consider all the 5 elements. So that gives you the expanded picture. Does that help?
Okay, yeah. So it's like a continuation of E.J. Ma's original theory.
Completion of E.J. Ma's theory.
Okay.
Oh, you could say expansion, because who knows it's completed ever, right?
Yeah.
Yeah. Okay.
So with herbs though, we're still can focus on just the 4 constitution.
Herbal medicine, 4 constitution seems to be enough. There were attempts for 8 constitution and 16 constitution, but nobody's been successful. And 8 constitution seems to be having 4 sub within the main, not 4 separate additional constitutions.
Just excess and deficiency cases of each constitution?
Yeah, so then, okay, going back to Tai-Yin, big wood, small metal. That's the same thing as excess wood, deficient metal. Same meaning, using different words. And that's constitutional, meaning the person is born like that. That's fine, as long as it's not out of bound, causing a problem. That's different from syndrome differentiation. Syndrome is a collection of signs and symptoms. Next time you see the patient and the patient has different signs and symptoms, now you have to diagnose differently because signs and symptoms are different. That's called syndrome medicine, which is traditional Chinese medicine. Constitutional medicine is symptoms and signs can vary, but fundamentally there is the sameness underneath. You see the difference there?
Yeah.
Yeah, okay, yeah. So then this excess deficiency, big, small, more or less, those are all same meaning. And it just, are we going to differentiate based on the symptom signs or the constitution? Constitution means helping the body at the fundamental level as much as possible. Person focused, in other words, not problem focused. Okay. I hope that helps. Didn't want to go too much off because you don't go into a lot of discussion. But that's important to touch upon because what's the difference? I think we need to know that. Okay, so then he had 4 acupuncture treatments in 4 days. After the first treatment, there was an immediate lessening of the need to itch and better sleep at night. The lesions began to form scab and the redness were smaller, indicating there was healing. Okay, at the 4th visit, it was clear that he was improving. Yeah, just help the body to help itself and things are more efficient, quicker, and less intense. Okay. Because we tend to think about, oh, we need this, we need vaccine, we need that. Probably we do. But that does not mean you cannot do acupuncture together. There's no contraindication. Okay. Next, pregnancy nausea. Okay. Because oftentimes we tend to be cautious in giving acupuncture to a pregnant person. Female, age 38. The patient was 6 weeks pregnant and had a constant nausea all day and night. She had a low appetite and even drinking water was difficult. In addition, she had a chronic tightness in neck and sacroiliac area. For females, for pregnant ladies, first 3 months is most difficult. And the last 3 weeks is difficult because of back pain and ache and fatigue, things like that. Second trimester is the best. Okay. So in the first trimester with a lot of nausea, cannot sleep, acupuncture. Okay. So then with the acupuncture, right side yin horary points in wood order, liver 1, heart 8, spleen 3, lung 8, and kidney 10. After the first treatment, the nausea had immediately subsided. She ate a large amount of dinner that evening. She woke up next morning with less tightness in neck and sacroiliac area than usual. So the neck pain and sacroiliac pain were pre-existing condition before she became pregnant. So it helps the body to regulate itself, helps the mother to become more comfortable with the process of pregnancy. Alcohol withdrawal and liver failure. Male, age 52, scientist. The patient admitted himself into a sober living facility due to liver failure from excessive alcohol drinking. In addition, he had pain in right knee, left Achilles, and left hip, which were aggravated with prolonged standing or lying down. So this guy, scientist at a local company, big company, he overdrank because he had family issues. His uncle passed away, his family member passed away. He was depressed, drinking. Liver failure. Liver failure causes ascites, ascites. That's collection of water in the abdomen. And if that's very severe, then it collects in the legs too. See, you see the photo of his leg? It's swollen because he had liver failure. Admitted himself to the sober living house because he had to stop drinking. And yes, he was slowly improving. The ascites was slowly getting better. While he was not doing anything, he decided to get acupuncture for his aches and pains. Knee pain, Achilles pain, hip pain. I gave him acupuncture right side yang horary points, 70%. He had 6 acupuncture treatments at twice a week. So at the end of 3 weeks, it was easier to assess. Each treatment was helpful in relieving discomfort in the mind and the pain in the body. So mind and body, acupuncture, brain and body physiology. Furthermore, he noticed an accelerated reduction of edema in the legs, which indicated his liver was functioning more normally. It was recovering faster. Acupuncture promotes healing. Acupuncture helps the organs too. Acupuncture is especially more helpful in the acute stage. If it's chronic organ problem, then herbal medicine is necessary. Okay, good. Acupuncture for both as internal medicine and also external medicine. That's the point of saying this. Next case. Neck, head, and ear pain, opiate withdrawal. Constant neck, female, age 50. Constant neck, head, and ear pain for 1 year. Was aggravated with hot shower, elevated noise, and anxiety. Exhaustive tests ruled out problems other than cervical disc herniation and possible multiple sclerosis. Prone to anxiety. Left side, yang points, 70%. So this patient has 6 acupuncture treatments so far, twice a week. Patients tend to get twice a week acupuncture. You could do more acupuncture, it would be even better, faster. First treatment immediately relieved the pain. She reported the relief was still better at the second visit. And she decided to reduce her Vicodin, which is opiate. Each treatment was additionally helpful in not only reducing the pain, but also increasing sense of well-being regarding intensity, frequency, and duration. Okay, we talked about health and well-being earlier. Health is less problem, better function. Well-being is quality of oneself. Can you have health but no well-being? Life sucks. You gotta have both well-being and health. And drug withdrawal is a lot related to well-being. Increased in well-being means minimal drug withdrawal. Vicodin is difficult to get off. Opiates are highly difficult to get off, but it's definitely easier possible with acupuncture because they're less uncomfortable within. Because if they're uncomfortable, they'll look for a quick solution somewhere and they'll resume the medication. But if they're less uncomfortable, then they could write it out. Wait. Let time pass so things become normal again. Although there were minor fluctuations of the withdrawal symptom from day to day, weekly was definitely clearly improving. Overall, the chemical withdrawal symptom was minor. Even with multiple sclerosis flare-up, acupuncture helped with that too. Less inflammation. Acupuncture is good for immune system too. It helps with the immune system issue. Although a fundamental correction of the immune system issue is done with herbal medicine. Okay, next case. Chemotherapy side effects. Okay, let's read these numbers here. The top line, it says red blood cell, and then platelet, and then white blood cells. Any question, any thought? Okay. Next line is white blood cell, monocyte, neutrophil. The last one is the white blood cell. So when people get chemotherapy, anything that grows fast dies. That's red blood cell and white blood cell. So then the patient's red blood cell count baseline was 4.52. After the first chemo, it went down to 3.9. Second chemo, 3.8. Third chemo, 3.6. Fourth chemo, 3.5. Steadily going down, but not drastically going down because this patient had twice a week acupuncture. There's objective measurement and there's subjective measurement. Chemotherapy causes nausea, ache, pain, neuropathy, discomfort, fatigue, many things. Subjectively, they feel better. Objectively, now you could do the count. Oh, the red blood cell count has stabilized. Oh, white blood cell count has also stabilized. That's objective. Oh, acupuncture is working therefore. Okay. So this patient, after the first chemotherapy for breast cancer, she had intense nausea, fatigue, thrush in the mouth, burning urination, anxiety, and constipation. She wanted to try acupuncture immediately after the second therapy because the adverse effects were debilitating. Too intense. Her chemotherapy schedule was at every 3 weeks for a total of 6 treatments. Left side, yin horary points, metal order, that's 30%. The patient had 11 sessions of acupuncture in a period of 12 weeks. That's roughly once a week. There was no relief with the first treatment with the 70%. And then I changed to 30%. And then the patient had immediate reduction of many symptoms with the metal order, which is 30%. Continuation of that 30% points was dramatic in effect. It relieved the symptoms, which is subjective, and stabilized red and white blood cells. That's why acupuncture is very important in conjunction with chemotherapy. Acupuncture promotes healing at the constitutional level. Now you see examples like this. Long COVID. This patient was female, age 39. COVID 14 months ago. She caught it at the beginning of COVID fashion, or however you say it, spread, at the beginning of the spread. She had cold flu symptoms, high blood pressure, high heart rate, loss of appetite, loss of smell taste, lead taste in the mouth, persistent symptoms of fatigue, mind in the body, daily pain, left hip, pain down to the foot, headache, shortness of breath. She exercised a little bit. It sets her back like 2 or 3 days. Hard time exercising. Acupuncture, right side, yang horary points, 70%. I gave her 5 points because she's a lesser yin, greater yang combination, which is a soulmin. This person is a vata, V-A-T-A, in Ayurveda. Okay, vata is soulmin and also lesser yin and greater yang combination. And you can see there's many other ways to diagnose Western, Myers-Briggs, 16 personality types, Unani, which is 4 temperament medicine. Okay, so using those diagnostic methods point towards being the same diagnosis. And I gave her the treatment accordingly. She improved further. Of course, at the beginning, I only did 70%. I did not add constitutional acupuncture. All right, here are the points. LI1, 2 acupuncture needles, small intestine 5, 2 acupuncture needles, 1 needle in each spot. No, 3 acupuncture needles in small intestine 5. 1 needle LI1, 2 needles small intestine 5. 10 minutes later, I added 1 on each point. Same thing, stomach 36, you see 3, gallbladder 41, you see 2, UV 66, you see 2. So first is 1 needle on UV 66, gallbladder 41, and 2 in stomach 36. 10 minutes later, I added 1 each. All right, treatment process, 20 treatments in 13 weeks. Twice a week for the first 10 visits and once a week afterwards. Gradual, steady improvement in intensity, frequency, and duration, for sure on a weekly basis, although she was easily set back. Increased days of feeling normal. Hold on a moment. Okay. Increased days of feeling normal, can jog and do things afterwards. And the last few days were the best. She was recommended to take ginseng, cinnamon, ginger, which accelerate her improvement rate. She was a teacher and a graduate student. It was a struggle to mentally and physically bring herself up to the daily busy task. She was a master's student. And she also worked at a school. And she was doing a research paper. While she was getting acupuncture with me, she gradually recovered from the long COVID. And I had her take herbs because she needed plant medicine to recover faster. And eventually I gave her herbal formula to take. And this was 3 years ago. She's now a PhD full scholar student at University of Kentucky. Okay, which means that she was able to successfully finish her study, move on to a PhD program with a full scholarship. She orders herbs for me to send to her every 2 or 3 months. And I send her Sichuan Dabutang, or a famous herbal formula for lesser yin. Oh yes, I treated COVID with acupuncture too. Acupuncture helps. Okay, I should talk more about treating cold and herbs with acupuncture and herbal medicine. Acupuncture is helpful every season. Same points are helpful every season, although the virus changes, although the patient gets new virus. In spite of that, acupuncture helps to recover faster, lessen the symptoms, and help to recover faster. And two, the herbal medicine. The traditional Chinese herbal medicine also treats COVID. And I use these herbal medicine for common cold and flu and COVID with the same benefit. Although it changes every year, herbs remain the same. With the same herbs, patients improve. Okay. Okay, next. This patient, low back pain, sciatica, and restless leg. The patient had chronic low back pain and constant nerve pain down the whole left leg. He had 3 epidurals and surgery, but there was no significant relief. Left side horary points, 30%. I gave him 70%. That didn't help. I changed to 30% wood odor. That helped. And that got rid of most of the pain in the back and the leg. Although epidurals didn't help. Surgery didn't help. Okay. And then 1 year ago, that was 10 years later, he came in with the restless leg syndrome. Restless leg syndrome, the legs cannot rest, high anxiety, cannot sleep. Gave him the same points. See here? Gave him the same points. Restless leg syndrome got better. Like 95% gone. Okay, different condition, same person. Low back pain, low energy, okay. Well, let me see, that was the last one, huh? No, that was not the last one. Oh, I see there's more that's coming up. Okay, let's talk about, okay, cervicalgia, radiculitis, that helps too. Hot flashes. Okay, hot flashes. That's hormone related, right? Since the full hysterectomy 3 months ago, due to fibroid cyst and it's like 2.5 pounds of fibroid cyst removed. She developed unpleasant psychological and physical symptoms. She burst into tears when thinking about her son or calling out his name. No hormone replacement therapy. Hot flashes were 4 times a day. Every morning 6 a.m. with a little bit of night sweat. And she had this weird sensation up in her chest, throat area. And painful muscle contraction in the left arm and the left leg. Okay. So weird symptoms, pains, weird movement in her chest, throat, and she would be very emotional. And it was not characteristic of her, because her whole life she was pretty a tough lady. I gave her left side yin 70% points. After the first treatment, the tearing of the eyes on the thought of her son immediately ceased. On the second visit, she reported no more tearing. The left side, chest gurgling, arm pain, and leg pain were less by 50%. 5 acupuncture treatments in 3 weeks, twice a week and then once. The patient reported an overall 75% relief. It's really hard for patients to tell doctors these symptoms because they're problem focused. What are they going to do? Give her a psychotic medicine or hormone replacement? But the patient knows what they're going through. Very uncomfortable. Acupuncture relieves that. Then that's the real thing. We want to verify what it is, but what if we cannot? Does that mean we cannot treat it? The human body is so wide and deep that we just cannot know many things. But human body has a capacity to treat. And we need both biomolecular medicine and natural medicine as right hand and left hand to work together for patients' health and well-being. All right, so then I think these exercises helped you to understand that we pick the right side, left side, yang, yin, try the 70%, try the 30% for a variety of situations. I think you understand then now how Bisoma acupuncture works.